Good morning, everyone. Once again, Dr. Salim is here with you guys. Let's do some practice of registry review questions for ARDMS. Especially, we're talking about the SPI. It can be in any of the specialty, but specifically for the SPI. As you know, we have this series of review questions. So let me share the screen with you guys one more time and share the questions with you guys. Just be with me. Okay. So here they are. Let's do a few questions. Now, the question is asking that what are the units for bandwidth? So the bandwidth, let's do this question later. First, let's do the question before that. And then it will be more easy to understand the question number 121. Let's do 22 first. So choose the correct formula for bandwidth calculation. Now you have bandwidth is equal to quality factor divided by operating frequency. Bandwidth is equal to operating frequency divided by Q or quality factor. Bandwidth is equal to operating frequency times quality factor. Bandwidth is equal to propagation speed of the sound times operating frequency, or bandwidth is equal to propagation speed of the sound divided by operating frequency. What do you think, which one, if you remember from ultrasound physics, what do you think, which one is the correct answer or option? Yes, B is the correct answer because the bandwidth formula is operating frequency divided by the quality factor. Now, if we look here, quality factor is a number. There is no, we can say there's no unit of that. It's just a unitless, it's a number, it's a digit. So operating frequency, mostly we have megahertz. So in this case, now if we come to the question number 21, it says, what are the units for bandwidth? So because of this formula, which is B, bandwidth is equal to operating frequency divided by quality factor. Now we can tell that the best answer is C for the question number 121, and that is megahertz. Now we did both questions in one time. So this question, we did it earlier just to know and make sure that which unit is the correct answer. Good job. Now let's keep going for the next question. Okay, so the next question is, if you are scanning a common carotid artery with 7 megahertz transducer, which create 3 cycles per pulse and wavelength of each cycle is 3 millimeter, calculate the bandwidth. Now, let me give you a hint. The hint is, now we know the formula that the operating frequency divided by the Q is the quality factor. Now, what do you think, which one from this question will be the correct answer? A, 2.3 megahertz, B, 21 megahertz, C, 9 megahertz, D, 10 megahertz, or E, 6 megahertz. What do you think? Which one is the correct answer? Exactly, you're right. It is 2.3 megahertz. Why? Because we have operating frequency, which is 7 megahertz. And then it's telling you, which creates 3 cycles per pulse. Now, this wavelength for the 3 millimeter, it's just to make you a little confused. So I made this question just to see if you understand the question, if you know the formula. So this 3 millimeter is just an extra information. Now, the original information is here, creates 3 cycles per pulse. Quality factor in a short pulse is actually equal to the number of cycles created in one pulse. That is the quality factor. So 7 divided by 3. 3 is the Q. And 7 is a megahertz. That's the operating frequency. So that will be, result will be 2.3. Good job. That is the correct answer. Let's do the next question. Now, this question is asking, what is the relationship between quality factor and bandwidth? Now, this is a super easiest question in the world because we already know the formula. Just earlier, I mentioned you the formula on question number 122, correct? So exactly, you're right. They have indirect relationship. Why? Because the bandwidth is equal to operating frequency divided by quality factor. So quality factor is denominator. So that Q have indirect relationship. If the number of pulse cycles in a pulse increase, the bandwidth narrow. The bandwidth become narrow, or we can say small bandwidth, not a wider. If the number of cycles in a pulse decrease, the numbers become smaller number. So of course that's a denominator. When that's a smaller number, the bandwidth will widen. Good job. Now, if somebody asks you this question oppositely, that what is the relationship between the bandwidth and operating frequency. So remember, that is a direct relationship on that case. Okay. Now let's do the next question. Okay, this question is asking that choose the best option for pulse wave ultrasound. Like, would you think which of the following options are correct for the pulse wave ultrasound? Because we have two types of ultrasound, don't forget. One is continuous wave ultrasound, one is pulse wave. Now this question is asking which option was suitable for the pulse wave ultrasound. A, broader or wider bandwidth, like it has a wider bandwidth. B, low quality factor. C, less sensitive or sensitivity. And D, shorter pulses. Or E, all of the above. What do you think? Which one will be the correct answer? Yes, all of the above is the correct answer, because in a pulse wave ultrasound, our bandwidth is wider, because in pulse wave ultrasound, the pulses are shorter, the quality factor is smaller. So we have a small number of quality factor. They have a low quality. So both of them answered, and they are less sensitive because they will not only target one point, they will target the whole area. So they are less sensitive. And also they're using one crystal system. Remember, it send the pulse and listen to that. So that's why it's less sensitive. And the pulses are normally shorter. So all of the above is the correct answer. Now let's do the next question. The next question is, select the correct option for those transducer which produce long pulses. Long pulses mean a lot of cycles on that pulse, like uncountable cycles in a pulse. What do you think? They are more sensitive. They are non-imaging modality. They have narrow bandwidth. They have high quality factor. All of the above. What do you think? Which one is the correct answer? Yes, I am agree. All of the above, because continuous wave ultrasounds, they will produce a very long pulse, like uncountable cycles are there in that one pulse. So they are more sensitive because they target one point. And then they're non-imaging because the same pulse will not return to the same crystal. It will return to a different crystal. It means the same crystal who generate the pulse will not listen to reflection. So they are non-imaging. There is no picture on them. And they have narrow bandwidth because they just, remember, we said bandwidth is equal to operating frequency divided by quality factor. Quality factor here, uncountable cycles are there. It's a long pulse. So bandwidth will become narrow because it's denominator, the Q. And then they have a high quality factor because, like I said earlier for you guys, that the quality factor is the number of cycles in a short pulse. And this is a very long pulse. So in this case, how many cycles are there? Uncountable. So it means the quality factor is equal to the number of cycles in a pulse. So it is a very high quality actually. Next question. So the next question is, calculate quality factor for 12 megahertz transducer with 5 millimeter SPL, special pulse length, and 2 cycles per pulse are generated. So now this is a lot easy question. What do you think? A2, B5, C12, D10, CE6. What do you think? Which one is the correct answer? Just we were talking about all these things. So previously I answered already. Yes, of course, it's 2. Why quality factor is 2? We said calculate the quality factor because there are 2 cycles. So the number of cycles are equal to the quality factor 2. That is the correct answer. Good job. Now let's do the next question. So now this question is, let me bring this a little bit up so we will see all of the answers. Now the question is, decrease in amplitude, power, and intensity are called, like, what is this definition for? This definition stands for which of the following options? Now we have amplification, we have attenuation, we have a compensation, we have compression, or none of the above. What do you think? Which one will be more suitable for this definition? Yes, absolutely. B is the correct answer. So attenuation, it's the last. We're losing amplitude, power, and intensity. So slowly, when the sound go from superficial to the deeper area, they will lose intensity, amplitude, and then we will have a dark picture, more black picture, more darkness on the bottom of the picture. It's just because of attenuation. And attenuation is actually decrease or lose of amplitude, power, and intensity of the sound. That is correct answer. Let's do the next question. Yep. So this question is basically asking, brightness mode is also called, like, what do you think, what can be the other name for the brightness mode? So the answers are 2D gain, B, receiver gain, C, overall gain, D, all of the above, E, none of the above. What do you think? Very easy question. Yes, all of the above, because brightness mode, a 2D gain, receiver gain, overall gain, you give more brighting, more like you make your picture more brighter or darker. So that is the, now we call it 2D gain. That's like the common name for that. So it means all of the above is the correct answer. Good job. Let's do the next question. All right. Now, TGCs in sonography stand for what? Like normally we say TGC. What does it stand for? Okay, now A, telephone and gas company, because it's TGC, is that? Or time gain compensation, because TGC. Or is it C, time with gram calculation, because TGC again? Or D, time gram and Celsius centigrade, so because TG and C. So what do you think? Or none of the above. What do you think? Which one is the correct option? For TGC? Yes, don't be. Yes, absolutely, you're right. That is time gain compensation. TGC, that is the correct standing for that. So in sonography, in ultrasound, that is the correct one. Time gain compensation. Absolutely right. Like we compensate, we lost the sound, and now we compensate in which depth you want to compensate. And so that's the timing for the pulse. Where they're losing, we compensate on that timing area. Okay, good. Now, let's do the next question. Okay, simple question, very easy. How many TGCs are mostly seen in a scanner or ultrasound machine? Most commonly, how many TGCs are there in a machine? Most commonly. A, 4, B, 1, C, 8, or D, 2, or E, 12. What do you think? I mean, that's like really kindergarten question, I can say. Yes, that is correct. 8 TGCs. So the first 3 TGCs are called near field, and the first 4 TGCs are called near field, and the second 4 TGCs are called far TGCs, far field TGCs. Correct. Okay. Now let me see, what is this? This question is asking basically the TGCs are also called, like, what are the other names for the TGC, time gain compensation? Is it DGCs? Is it SGCs? Is it both of them? A and B is correct, or none of them? Yes, both of them are correct. Absolutely, C is the correct answer, because it's called time gain compensation, it's called depth gain compensation, and it's called swept gain compensation. These are all the same names for the TGC or time gain compensation. Okay, now next question. It's asking, choose the correct unit for attenuation. Like, be carefully here, okay? Attenuation, remember, but let me ask the question first. So what do you think, which one is the correct answer? Hertz, decibel, positively decibel, percentage, negative decibel, millimeter, in a microsecond. What do you think, which one is more suitable, makes sense, correct answer? Yes, that is decibel, but negative decibel, because attenuation itself is losing of something. So we're losing sound and a shape of amplitude and intensity and power. So we are not gaining, we're losing, correct? So losing, that would be negative. It's a decibel, but negative decibel. Be careful. Okay, next question. Now it's asking that the conversion of sound energy to heat and sonography is which of the following component of attenuation? So attenuation have different components. It has absorption, it has reflection, it has scattering. So what do you, backscattering also. So what do you think, which of these options will be correct for that portion, for that component of the sound, which which converts the sound to the heat energy. It's a sound energy to the heat. What do you think? Yes, A is the correct answer. It's called absorption. So in the tissue, they will produce heat. The sound energy will convert to the heat energy. And this way, we are losing sound. And that is the component of attenuation, because those are the attenuation that the sound is losing their energy. That is correct. Oh, E, all of the above. Anyway, E was not the correct answer. So A was the absorption was the correct answer. Okay, next question. Which of the following is a concern of bioeffect from attenuation components? Like which one is more a concern, more like we can say can cause bioeffect? Is it reflection is causing? Is it absorption? Is it scattering? Is it backscattering? Or none of the above? What do you think? Which one will be the best correct option to be selected? Yes, I am also agree with you. That is called absorption, because like just earlier in the previous question, we just mentioned that the energy of sound will convert to the heat energy. And this way, that heat will produce a mechanical index to go higher. And that thermal and mechanical index, when they go higher, they will produce bubbles. And those bubbles will cause, we have transit bubbles and we have stable bubbles. So they will cause, if they don't burst, they will cause bioeffect. Or when they burst, sorry, when they burst and they will cause bioeffect. So that is the damage of tissues. Absorption is the correct answer. Next. Okay. The part of reflected sound which never returns to the sound resource or source or back to the transducer is called what? Refraction, reflection, backscatter, scattering, or apodization. Which one is the correct option? That part of the sound, they just go to other directions. They do not come to the transducer back. I think now the question is easy. Answer is easy. Yes. When they never come back, they are called scattering. So those are the echoes, those are the reflections which never come back to the transducer. They just go to other directions. Absolutely correct. Let's do the next question. Okay, now it's asking for what would be the attenuation coefficient of 10 megahertz transducer. So what do you think? If we are using a 10 megahertz transducer, what will be the attenuation coefficient? Now, okay, these are the answers. Minus 10 decibel, minus 5 decibel, minus 1 decibel, or plus 5 decibel, or all of them are not correct. None of the above, I mean. So what do you think? First of all, let me give you a hint. You should know the formula for attenuation, how to calculate. And for the coefficient, how we can know attenuation coefficient for a transducer which is known for its frequency. Yes, that is absolutely minus 5 decibel. But remember, easy way to remember that how to calculate coefficient for attenuation coefficient for a transducer which is known for the frequency. For example, if you have 10 megahertz, half of that is attenuation coefficient. If you have 12 megahertz, 6 megahertz. If you have 4 megahertz, 2 megahertz. So any operating frequency transducer, you have half of that divided by 2, that will be attenuation coefficient. Keep in mind, that will be one of a tricky question in the SPI. Be careful with that. Okay, let's do the next question. So this question is asking for what would be the attenuation of sound if we had attenuation coefficient of 5 decibel in a centimeter and the depth was set to 2 centimeters. Now, this question also needs a formula. If you remember the formula, a lot easier how to calculate and choose the correct option. So the options are minus 2 decibel, minus 5 decibel, minus 10 decibel, minus 2.5 decibel, and minus 7 decibel. What do you think? Exactly, you're right. It is minus 10 decibel. Now the question is where the minus 10 decibel came from. Remember that the formula, it's asking for not attenuation coefficient. It's already given to you. It's asking this attenuation mean in this question, total attenuation. So how much total sound did you lost in a 2 centimeter depth? So we have a formula that total attenuation is equal to attenuation coefficient multiply with the depth or path length. So here, the attenuation coefficient is already given in the formula. In the question, it's given to you. So that's a known number. It's a 5 decibel and a centimeter. And then also the path length or depth is also known. It says 2 centimeter depth. So attenuation coefficient multiply with the depth or path length. And that is 2 times 5. And that will be 10. Why minus? Because it's attenuation. Correct? Okay, good job. Let's do the next question. Now, this question is asking, what would be the attenuation of the sound if we had attenuation coefficient of 7 decibel in a centimeter and the depth was set to 30 millimeter? It's exactly the previous question, only the number changed. And there's one thing changed. Remember, it says 30 millimeter. So first of all, we have to convert this millimeter to centimeter because in our depth, we have this centimeter here too. So this centimeter has to cancel with this centimeter, and then only thing will have your unit will be only decibel. Remember in the previous question, just we did that the unit for the attenuation is decibel, but minus decibel, not positive, because that's amplification. If we do positive, it's a negative. That's why it's attenuation. It's the loss of the sound. So the 30 millimeter has to convert to the centimeter. And remember, we all know from our high schools that 10 millimeter is equal to 1 centimeter. This is 30 millimeter. It means this is 3 centimeter there. So 3 times 7 will be 21. So the first A is the correct answer here, correct? Because it's 21 decibel minus because it's attenuation. Okay, good. Let's do the last question for this session. The last question is asking that the maximum variation that occurs in an acoustic variable or sound wave is called which of the following? So this is basically the question I wrote for you. The question is giving to you as a definition. So this definition suitable or goes to which of the following option? So it is intensity, focus, amplitude, weak echoes, or bioeffect. What do you think? It's a lot easy question, honestly. Yes, C is the correct answer. Amplitude. Actually, amplitude is the maximum variation that occurs in an acoustic variable or in a sound wave. That is the correct answer. Good job, my dear listeners, my dear healthcare providers. So please remember, if there is anyone who needs these questions, these type of review registry questions, this is a practice questions. It will build that person and prepare that person for the ARDMS, American Registry for Diagnostic Medical Sonography examinations. Why not? Please do not forget to share the channel with them and also remind them if they want more these type of questions. So please subscribe the channel to get a notification for upcoming videos, sessions. Thanks a lot and take care. See you in next session. Take care.